available for the future. So, hello everybody, I'm Roger Jackson. I'm the president of SFT 2275, which is the local union, part of our statewide union. And back in December, we finished the negotiation of our most recent 4-year contract. Part of that agreement required the renegotiation of healthcare plan, which we piggybacked on from the work that CWA had done. So what we're going to do today is we're going to have Bart from Human Resources help lay out the salient features of that. And the rest of us are going to man the chat function and then send the questions along to Bart. Let me introduce, on the screen, we have Tina Zapili, who is the lead negotiator for SFT 2275. We have Joseph Everett, who is the vice president for the professional staff. We have Nazia Kazi, who is the grievance officer. And then we have Stacy Rose, who is the treasurer for the union. You will find in the Tina is posting a series of links, which should be helpful to you in terms of navigating all of this. We don't anticipate we're going to be able to answer every single question as we go along. But we're going to provide, we hope, a good foundation and a good start. So what I would like to do is just begin by having Bart Musitano lay out the basics of this, and then we'll go from there.
Okay, thank you. Good afternoon, everybody. So if you could bring up the plan comparison chart. So it should say the New Jersey, they should have the Division of Pensions logo. It should say Union Negotiated Plans for Plan Year 2020. So the basic from, the way, from an administrative point of view, the way I understand it, as employees, we all wanted to come off of Chapter 78, paying the percentage of premium, because none of us like that as employees. And from the state's point of view, there were obviously they want to reduce their benefits costs as well. So this was a negotiation and a compromise that from my perspective, looking at it is a good one. So the way it works is, and I have an email that is prepared that I'll follow up. I originally intended to get the email out before this webinar, but I will follow up with some of these links and additional explanation. So what I wanted to do was kind of go through the plans, how they're going to be, kind of give you some strategies to try to avoid problems after the fact. So the way it works is, as of right now, until October 1st, AFT members are in either one of the PPO plans, one of the New Jersey Direct plans. So it could be New Jersey Direct 15, New Jersey Direct 1525, New Jersey Direct 2030, or New Jersey Direct 2035. They were the options of the PPO plans that you had. In addition, some of you are in Horizon HMO, all right? Others are in the Horizon Omnia Plan, which is the tiered plan, which I'll explain. So I kind of looked at a roster of all of you yesterday, and you are in one of these plans. So the way it will work after October 1st, and this is the same way it worked for CWA last July, and IFTI last November, and the Stockton managers in September 1st. So everybody is moving into these new plans. So the way it will work is, if you have any of the New Jersey Direct PPO plans, 15, 1525, 2030, or 2035, you are going to move into the New Jersey Direct or the New Jersey Direct 2019 plan. So for starting October 1st, there's only one PPO plan. It's either New Jersey Direct and New Jersey Direct 2019. What the distinction between New Jersey Direct or New Jersey Direct 2019 is if you were hired after July 1, 2019, anyone hired after July 1, 2019 is going into the New Jersey Direct 2019 plan. And I'll explain the difference in a little bit. But if you're already in a PPO, you will go into the New Jersey Direct plan, also a PPO, on October 1st, all right? It's basically, so to kind of put people's mind at ease, it's basically the same plan. So there are many New Jersey Direct plans. I mentioned all the ones we had here. In addition, people in the K through 12 district had the option of a New Jersey Direct 10, which was a $10 copay. Last year, NJEA negotiated a New Jersey Direct 0 plan, which was a 0 copay. So there's all of these New Jersey Direct plans. It's basically the same plan. The distinction was the copays or the deductibles. So put your mind at ease. You are in this, if you have New Jersey Direct now, you will still have the same plan. It's basically copays and deductibles that may change. Your network is exactly the same. Everything that was in network before is still in network now. It's the same plan. Even your Horizon ID number, that 3HZN number, is still the same. So when my position follows CWA. When I moved last July, I moved from New Jersey Direct 15 to the Unity Direct plan, which is basically this plan. I kept my same ID number. In fact, 5 years ago, when I came from Atlantic Cape to Stockton, I carried my 3HZN number with me. So that number stays with you. You will probably get new cards with the 10/1 effective date. But in the meantime, if you need to go to the doctors, your doctor will find you under that 3HZN number. When they contact the insurance company, Horizon will find you. If you are, so I'll come back to that in a minute. If you are in the Horizon HMO plan, which a few of you are, you will stay in the Horizon HMO plan, no change, okay? If you are in the Horizon Omnia plan, you will stay in the Horizon Omnia plan. It's still the same plan. There will be your cost share. When I say cost share, I refer to the amount that comes out of our paycheck for our benefits. If you're in Horizon Omnia, your cost share will change. New Jersey Direct's cost share will change. All right. Horizon HMO, if you're in the HMO, your cost share will not change. You're still paying the percentage of the premium under Chapter 78. None of the AFT people are in the high deductible plan, so I won't, that plan doesn't change either, but none of you are in that. Okay, so let's look at, so again, there's nothing you need to do. And I've been checking some of you on the state system, and I'm starting to see that the plans have appeared, the New Jersey Direct plan with a 10/1 effective date. So the state has already moved you over. Nothing you need to do. Keep in mind, as I go through kind of the highlights of these plans, question, Roger?
Oh, just continue with your thought, and then I'll ask you the question from a member.
So keep in mind, October 1st is also the state's open enrollment. All right. So you do have the option during the month of October to make a change to your plan, which would be effective January 1st, same as every year at open enrollment. So you're moving, or, you may be changing plans on October 1st, but you'd have the option as every other year to make a plan change for January 1st. We have gotten no information about open enrollment yet. So I don't know if there are any additional changes with open enrollment that would be effective January 1st, but I would communicate them to you the same way I do every year as soon as I get those changes for open enrollment. Okay. You want to go, Roger, before I keep going?
Yeah, just as questions come in from our participants, we'll field them over to you. And this is from an individual who said that as of January 1st, last January, they got switched out from Aetna to Horizon NJ15.
Correct.
Yeah.
So last open enrollment, Aetna, as of January 1st, 2020, on the active side, Aetna went away. All the plans are Horizon plans. And the way it worked was there was a mirror plan Aetna and Horizon had the exact same plans. You just chose the network. Do you want the Aetna network or the Horizon network? As of January 1st, on the active side, Aetna went away. Aetna still has for the retirees that go on Medicare, Aetna still has the Medicare Advantage plan for the retirees. But on the active side, they're all Horizon plans, and that stays the same for this year.
So for that individual then, Aetna went away back on January 1st, 2020. They got switched into NJ 15.
Right.
So they are like, for example, myself, they are currently now in NJ 15. And so on October 1st, they will be switching like the rest of us into this new plan.
Correct. So if they were hired before July 1st of 2019, they'll be an NJ Direct. If they were hired after July 1st, they'll be an NJ Direct 2019. Okay. Anything else on the?
Again, we'll keep them coming in right now. That's our first question.
Okay.
There, I'll go back and check again.
All right, so let's look at NJ Direct and NJ Direct 2019. So again, this is anybody that is currently in an NJ Direct PPO plan, 15, 1525, 2030, 2035. You're all going into this new NJ Direct plan. And when I say into it, remember, it's the same plan, just different copays. All right, so if you look at that, your copays for office visits are the same as you have now. Still $15 for an office visit, still $15 even if it's a specialist. Same thing, no referrals. You go to an in-network provider, you're paying $15. And remember, this is a nationwide PPO network, all right? You, on your medical card, you see in the bottom corner, you see that little suitcase that has the PPO emblem. That means that if you're traveling out of state, as long as you're using a provider in that state that participates with that state's Blue Cross PPO network, Horizon will treat you in network. So remember, like every state has a Blue Cross is nationwide. In New Jersey, we call it Horizon. In Pennsylvania, they call it Independence Blue Cross. I think in New York, it's Empire Blue Cross. Every state has a Blue Cross. As long as the provider participates with that state's Blue Cross, is in network with that state's Blue Cross PPO network, Horizon will treat you in network. Go right to the provider, you're paying $15 copays. So there's a difference, the next one down, the emergency room copay. I believe with Direct 15, it's currently $100. It's now going to $150 for the emergency room copay. All right. There's a couple exceptions. If you are bringing a child to the emergency room under age 19, or it says through age 19, 19 and under, your copay for the emergency room is $50. All right. They don't want you to not bring your kid to the emergency room because you don't want to pay $150 copay. So under 19, it's a $50 copay. There's another exception which says if you have a referral from your primary care doctor, it's also a $50 copay. Now I called Blue Cross on this a few weeks ago, and the claims person, she said the way they understand it to mean is that if you're sick and you go to your primary care, you go to your doctor's office because you're sick, and the doctor from there sends you to the emergency room, you would have a $50 copay. You want and she said they would examine it in claims when they get the claim to make sure they got that referral. I think for bringing a child, that's an easy one. If you bring your child in the emergency room under 19, don't pay any more than $50 copay. Insist that the copay is $50 for a child under 19. And if they have to call Blue Cross, have them call Blue Cross and confirm that. They didn't give me an easy answer on the referral from the primary. She says she believes that, the person I talked to said she believed that they would have to see there would have to be a direct referral from an office visit to the emergency room. So I'm just kind of giving you that just as a heads up to, kind of watch out for that. Go ahead.
So again, we're getting questions in the Q&A section, so I'll send them to you along the way. This one seems to be a follow-up to what you just spoke about. Mm-hmm. We have a member asking, how are urgent care centers treating the emergency care copays.
I will have to get back to you on that.
Okay,
The question is that you go to an urgent care and they refer you. I can get a question. I'll get that. I'll write that down.
Okay. As we go through then, folks, as we have questions that Bart needs to do some more research on, we'll write these down and we'll put them as part of a document of unanswered questions at the moment.
Okay, yeah, that would be great. If you could write, yeah. Perfect. Okay. So that's the emergency room. So count on 150, but if you're bringing a kid under 19, do not pay any more than $50, because that one was pretty clear from the person I talked to. All right. So the next column down is the in-network deductible. So the in-network deductible only applies to the people in New Jersey Direct 2019. Okay, so this is anyone hired after July 1, 2019 is in the New Jersey Direct 2019 plan. For those people, they have an in-network deductible for certain things, not everything. So the in-network deductible, if you're hired after July 1, 2019, is $100. And that's for durable medical equipment, ambulance, ground ambulance service, and oxygen. So anything that is considered durable medical equipment, and I think, Roger, one of the examples they gave was, was it shoe orthotics? I think that was one of them. Anything, any kind of medical equipment. Kids that need, and so this $100 deductible only applies to the services, if you look at the next line down, only applies to the services that are co-insurance services. So for durable medical equipment, ambulance, and oxygen, you see your responsibility is 10%. New Jersey Direct pays 90% of those costs. So for instance, if you or your child has a nebulizer for asthma, all right, my kids did, I paid I was covered at 90%, I paid 10% for that. People that have sleep apnea, that have the CPAP machines, they're going to be covered, that's medical equipment, they're going to be covered at 90%, all right? So we're responsible for 10%. In addition to that, if you're hired after July 1, 2019, you have to meet a $100 deductible before those three types of things are covered: oxygen, medical equipment, ambulance. So you meet that $100 deductible, and then you're covered at 90%. Up to, so you see the annual in-network co-insurance maximum is $800 a person. So if you're paying that 10%, if you have a year where you need a lot of durable medical equipment and you're paying that 10%, once you hit the $800 for the year, you're good for the rest of the year. That's your maximum out of pocket. Okay. The next, so go down to the out-of-network deductible. So this is the biggest change starting October 1st. This is the biggest change. New Jersey Direct out-of-network had a $100 deductible, and after you met that $100 deductible, you were covered at 70%. So you had the first $100 and then 30% co-insurance up to an out-of-pocket maximum. Now you have a $400 deductible. $400 annual deductible if you use out-of-network providers, and you're then covered at 70% after you meet the $400 deductible. So this is the biggest, most significant change. If you use out-of-network providers, you have a larger deductible. All right. So, you know, you always wanted to be careful to try to use in-network providers. And remember, they are nationwide in-network providers. The major Philadelphia hospitals, the major New York hospitals, they all seem to be, you know, most of them are in-network. Just be a little extra careful that if you go out of network now, you do have the higher deductible. And remember that out of network, there's a term called balancing the bill. Out of network means that doctor does not have to abide by the rates that Blue Cross pays because they're out of network. So so the doctor can balance the bill. So if an office visit is $100 and Blue Cross says that office visit only is worth $80, we're only going to pay $80 after you meet your deductible. The doctor can then say, in addition, so you're responsible for 30% of $80 after the deductible, and Blue Cross would pay 70% of the $80. But the doctor can say, well, I charge $100. I'll take the 70% from Blue Cross. I'll take the 30% from you, but I'm also charging you the extra $20, the difference between $80 and $100, because I don't have to abide by Blue Cross schedule. So just keep in mind when you go out of network, the doctor is not obligated to accept payment in full from Blue Cross. They could balance the bill on you. So it's a little, that's the kind of the downside of this, is that it's a higher deductible. But on the payroll deduction, you'll see a bit of a positive there. If you go to in a hospital out of network, if you use an out of network hospital, there's an additional $500 deductible if it's an out of network hospital. Be very careful about using a hospital out of network, because remember, you're paying 30% of those charges. So you definitely want to try to stay in network if you're talking about hospital. Let me go back to the emergency room copay. So the emergency room copay, as always, if you're admitted to the hospital, the copay is waived. So if you go to the emergency room and they admit you, you're not paying the copay. That hasn't changed. If we scroll down, the second page there is the prescription copays. Your prescriptions are still through OptumRx. Your prescription benefits don't change, but the copays are a little different. Right now, under New Jersey Direct 15, we paid at the pharmacy, we paid $3 for generics, $10 for brands. With New Jersey Direct and New Jersey Direct 2019, we pay $7 for generics, $16 for brands at the pharmacy for a 30-day supply. If you go through the mail, the state did a trial this year, and hopefully they're going to continue it next year. The state did, if we get generics through the mail, we have a 0 copay. 90-day supply, no copay. If we have brand names, the copay is $40 for a 90-day supply if you get it through the mail. So any kind of maintenance drug, it benefits you to get through the mail a 90-day supply. If it's a generic, it's going to be free. If it's a brand name, it's going to be $40, rather than if you get it at the pharmacy a 90-day supply, you're going to pay $16 for each 30-day supply. This is not new, but if you have a medication that has a generic and you or your doctor insists on the brand name medication, you're going to pay the difference between the generic and the brand. That's not new with this plan, so that's been in existence. We were already dealing with that. You can try to get your doctor to make an appeal and all, but I would say most of the time, probably those appeals aren't going to be successful from what I've seen. Just to back up, and this is not different, this is completely the same as you've always had, but just kind of a word of warning, a word of caution, because when people come into me and Johanna to help them with claims resolution issues, a lot of times it's the same thing. Remember that a lot of diagnostic tests, MRIs, CAT scans need pre-authorizations. It is almost impossible to get a retroactive pre-authorization after you've had the test. So this is me kind of pleading with you. Please make sure that you are 100% sure you have that authorization before you get that diagnostic test up. I'm talking outpatient diagnostic tests. So you go to, I always use AMI, there may be other ones in network, but just make sure Atlantic Medical Imaging has that pre-authorization. before they do the test. Normally, they'll insist on having it before they schedule you, but do yourself a favor and just confirm with them. Also, I would also ask them, you know, and I've done this, is there anything I need to do? Do you need me to call Horizon, or are you taking care of it? Go ahead, Roger.
Just want to, you've been handling a bunch of questions about emergency room, and I just want to make sure we're, where questions are of a similar kind, we ask them at that time.
Okay.
If you're admitted to an out-of-network hospital for an emergency, would the coverage be the same as in-network?
Put that down for
that's good.
I mean, you have emergency coverage wherever you are if you have an emergency. I don't know about admittance though. I mean, I'd have to check on that. I would think if it were me as the patient, I'd want to try to get myself to a in-network hospital as soon as possible.
I'll put it down in our list of questions.
Yeah. I mean, I would, to avoid, I mean, if possible, to avoid complications, I'd want to get myself to an in-network hospital, but I'll check on that.
And let me just jump in relation to the earlier question that we had written down. I think the question was also simply not just if you get referred from an urgent care to the emergency room, what would that be? But also just what are the basic copays for an urgent care visit?
Urgent care visits are like primary or office visits. So they're $15. I've always paid $15 for urgent care.
Okay.
And one more, Bart, while you were doing this, in terms of the pre-authorization stuff. So for example, if I needed to get a pre-authorization for an MRI, would that be the case that I would go to a primary care physician first and then go there, or go to the specialist first?
Oh, yeah, no. So your doctor is obviously going to be the one that tells you to get this test. So your doctor is going to give you probably a script to bring to the diagnostic center. So either at that point, and I've done it, you're going to call the number for diagnostics screenings and get the authorization yourself, or you bring it to the diagnostic center and maybe they'll do it for you. Just make sure you've confirmed that you have the authorization number before you have the test, because it really is almost impossible to get it after. And those diagnostic tests are costly. So just always keep that in your mind, that you need to make sure that you have the authorization.
Thank you.
I mean, this is for outpatient stuff. Obviously, if you go to the emergency room and you're in the hospital and all, that's handled differently because now it's inpatient. But I'm talking about outpatient diagnostic tests, screening. And I do, so for anything, remember, I'm just giving you all kind of general information and tips to avoid aggravation later on. Know that Blue Cross, so I've been in this job 23, 24 years now, and I've been working with Blue Cross the whole time. Blue Cross is the best customer service line that I've dealt with anywhere. So they have these dedicated health guides, they call them now. They take notes. They have notes from all your previous calls. Any questions you have, if you want to be proactive and avoid issues later, please use those lines and get these questions answered, because there's nothing more, it's one of the more aggravating things to have to try to deal with these bills and the insurance after the fact. So if you can be proactive, call Blue Cross. They're very good. I use the line all the time. I use that customer service all the time. All right, so that's kind of in a nutshell, the New Jersey Direct. All right. Horizon HMOs, so the HMOs, so a few of you are in the HMOs. The thing about HMOs, they have no out-of-network coverage. All right, you have to go in network or you are completely 100% responsible for everything. You also have to get referrals for everything. So you go to your primary care doctor, and if I need to see a dermatologist or a cardiologist, I have to get a referral from my primary care to the specialist. If I do all that correctly, I pay copays, I'm covered at 100%. All right. If I skip a step, I'm responsible for 100%. All right. So, and Horizon HMO. So if you're in an HMO and you want to talk about perhaps going to a PPO, you would do that with us at Open Enrollment if you want to explore that option. So the third one over is the Omnia Plan, which there's a handful of you in the Omnia Plan. So the Omnia Plan is called a tiered plan. These are pretty popular out in the private sector. All right, and it's new to the state plan about 3 or 4 years ago, the state plan added it. The state loves this plan. In fact, they love it so much that the past few years they've been giving us financial incentives during open enrollment if we switch to the plan, which is probably why some of you that are in it. Tiered plan is kind of a hybrid plan between a PPO and an HMO. It's like a PPO in that you do not need referrals. So you can go directly to a specialist without getting a referral. It's like an HMO though, in that you do not have out-of-network benefits. If you are not using a provider in the network, you're responsible for 100%. So you'll see the tier network, the provider network, the network of doctors are divided into 2 tiers, tier 1 and tier 2. Between the 2 tiers, if you look at the entire network of providers, between the 2 tiers, it's pretty much the same network as the New Jersey Direct network. All right, so you've got this big nationwide New Jersey Direct network. All right. And then if you go over to Horizon Omnia, it's pretty much the same network, but now those doctors are doctors and providers and hospitals are divided into 2 tiers. If you have tier 1 providers, you notice you have low out-of-pocket costs if it's a tier 1 provider. You're paying $5 for an office visit, $15 for specialists, $100 for emergency room. You'll notice in tier 1, you have no in-network deductible in tier 1. All right. However, if your provider is tier 2, your copays are higher. You've got $20 copay for primary, $30 copay for specialists. And look here, anything other than a simple copayment, if it's a tier 2 provider, you have a $1,500 deductible before you are covered at 80%. So you pay the first $1,500 and then you'd have 20% coinsurance. All right. Little hint here about a little tip. You will not find any tier 1 providers outside of New Jersey. Any provider outside of New Jersey, doctor, hospital, would be tier 2. Does not mean every New Jersey provider is tier 1. It just means you won't find any tier 1 providers outside the state. There are some New Jersey providers that are also tier 2. However, a lot of the local, I believe both, you're going to want to check this, but I believe both local hospitals are tier 1. There's a lot of primary care doctors and specialists that are in tier 1 as well. So this would be your most significant savings as far as payroll deductions. The Horizon Omnia plan would be your most significant savings payroll deduction wise. All right, but I just want, before you do that, I want you to keep in mind that if your providers are tier 2, you have a $1,500 copay. I'm sorry, $1,500 deductible before you're covered at 80%. So you're going to save money in your paycheck, but if all of your providers are tier 2, or you use a lot of out-of-state providers that are going to be tier 2, you're going to pay that out-of-pocket cost somewhere. At one end or another, you're going to pay the out-of-pocket cost. So Omnia is, there's nothing wrong with the plan. It just, I would say, if you're going to take Omnia, you want to really do your homework before you select doctors. Make sure you know what tier your doctors are in. So this has happened a couple times. One complaint I get from Omnia is, so say for instance, you have surgery, all right? So you're scheduled for surgery, your surgeon is tier 1, the hospital you're going to is tier 1, all right? But I've actually had people come into me and they get this big bill from the anesthesiologist who is a tier 2 provider. So they're getting hit with a $1,500 deductible and then 80% and 20% co-insurance from the anesthesiologist. Now, if you, I would say, it's a fair statement that the morning of surgery, the last thing on your mind is double checking with the anesthesiologist when they come in to talk to you to make sure they're in the right tier. You know, I'm impressed if you're going to think to do that, if you're that brave the morning of surgery. I would say that, you know, that's the kind of little pitfalls that sometimes you could run into with this Omnia plan, where you could get a bill and not realize that somebody that saw you in the hospital, say, is a tier 2 provider. Again, this would be your most significant savings per paycheck. So if you're confident that all of your providers are in New Jersey and they're all tier 1 providers, you know, again, on the outside world, these tier network plans are popular plans. And the state is, you know, the state is definitely trying to incentivize this plan, because I guess would be the biggest savings for them. Perfectly good plan, just, you know, you have more to consider than you do with, say, the PPO plan. Because remember, the PPO plan is a really big in-network plan, plus you also have out-of-network coverage if your providers aren't in that large network. And you'll see, depending on, if you scroll down back to the second page, you'll see the copays for prescriptions. Again, it's still OptumRx. You have a separate prescription company, but the copays are directed by which medical plan you have. So that's kind of the breakdown of how the plans work. Now the cost share is, here's how the cost share works. If you are in the PPO plans, so New Jersey Direct 15, 1525, 2030, or 2035, you're going to go into the New Jersey Direct or New Jersey Direct 2019 plan. If with the PPOs starting October 1st, you are going to go from a percentage of the premium to a percentage of your salary. All right. And I believe they put in the chat one of the documents. Let me see if I can find one of the documents shows the union negotiated plans, New Jersey Direct member contribution rates. So I think that's a 10-page document. It shows you the salary levels and what you would be paying for the type of coverage in effective October 1st. So you're going from in New Jersey Direct, the PPO, you're going from percentage of the premium to percentage of your salary. I can say that when we noticed that when CWA moved, when IFTI moved, we noticed that the majority of people saw a reduction in their per pay deduction, going from percentage of premium to percentage of salary. All right, that's what we saw with the other unions. If you are in Horizon HMO, remember the HMO is staying on Chapter 78, so you would see no change. Chapter 78 is, is percentage of premium. You would see no change there. Okay. If you are in the Horizon Omnia plan currently, the Horizon Omnia plan, you are currently paying the percentage of premium for the Horizon Omnia plan. Under the new union negotiated cost shares, the Horizon Omnia plan is basically 75% of what the PPO plan is. So whatever the PPO cost would have been to you, the Horizon Omnia amounts to like 75% of that. So you'll see a payroll reduction for the Horizon Omnia plan. Go ahead, Joe.
Bart, somebody was asking if that is based on their yearly salary, their base salary, or does that include the gross, which might include additional stipends?
No overload stipends, it's your base salary. So the state has a calculator. Hang on, let me see if I can find it. I'm going to try to put this in the chat. Hang on. All right, wait a minute. I think I can do it. All right, so I just, I think that might have just gone to the panelists. If you guys could share that, I think that that is the right calculator.
Okay.
So I don't have an answer yet for faculty. I'm meeting payroll and I'm meeting with payroll tomorrow. We have to create, so you know that the 12-month employees have our deductions over 26 pays. Faculty deductions are over 22 pays. So currently, right now, we have to make an adjustment. We have special codes for the faculty, and that's regardless of whether you're a 10 over 12 pay schedule or a 10-month pay schedule. All of your medical deductions only come out over 22 pays. So the calculator, the state calculator, unfortunately doesn't have a calculation for 22 pays. So the payroll code makes that adjustment. So it takes what you would pay over 26 pays and divides it over 22 pays. So 12-month employees right now can use this calculator to figure out what their payroll deduction is. So you're going to use step one, and you've all seen this calculator before. Your annual salary, you're going to check biweekly 26 pays. You check the plan you have and the coverage level in section 3. Section 4, you're going to check your prescription coverage level, and then you hit calculate contribution. That's a ballpark estimate. It could be, once payroll calculates it, it could be a little higher, a little lower, but that's around what you're paying. I have to get, after I meet with payroll, I have to find out what the extra calculation faculty would do to convert that 26 to 22 pays. I know the calculation we use now under Chapter 78. I just have to confirm if it's the same one, and I'll know that within a few days probably. But again, if AFT follows the pattern that the other unions did, the other unions saw a bit of a payroll reduction on the benefits. I think that's the main stuff as far as the changes that I wanted to bring up. Is there anything that any other kind of questions that are coming in?
So I've been gathering up some questions. My computer went down, so I had to switch back over to another one.
Okay.
So some of these may have been asked while I was away. So let me go ahead and bring these up. What about R health? AR-health. Does that stay the same?
What is it?
The big letter R dash health. This was a question asked from one of our people. I'm sorry, I'm unfamiliar with it, so I can't.
Let me look that up because I'm M too.
Okay, all right. So then, let's see.
I like that one.
Yeah, we've got a couple of other questions. Just to clarify that the deductibles listed for the plans, those are annual deductibles, right? Not per event deductibles?
They're annual deductibles. Yeah, and there's always the slash, so it's the individual deductible and then the family deductibles after the slash.
Okay. And then also specifically the $400 deductible in the NJ Direct plan for out-of-network providers. Does that also apply to behavioral health care out-of-network?
I believe it does, but mark that down for me to confirm.
Okay.
Okay, so let's see. And we've had a couple of different questions of a variety of this sort in terms of both part-time folks you know, the 2/3 folks, as well as adjuncts. What is their relationship to the new plan?
So any part-time, so anybody less than 100% and adjuncts can buy into the state's program for part-time employees. We're coding for the state part-time employees depending on where they fall, what union they fall under. So it seems like they're going to have the same options, because we're going to let people know, we're going to let the state know that if you have a 50% or 75% faculty member, they are a faculty member that would be under this union code. So they would have these same options of these plans. And adjuncts, I believe, will also have the same options. Right now, adjuncts can buy into the New Jersey Direct 15 plan, but I believe that it will change, that they'll have the options of these plans as well. Or, I mean, only these plans. But they buy into it and they pay the state directly for that. The state bills them directly. So there's no payroll deduction issues for part-time employees.
We'll just keep following up with some of our questions that people had asked that covered. Have you already spoken about whether or not there will be new cards issued?
There should be new cards issued for AFT, the 10/1 effective date. But again, the group number, when CWA changed, the group number changed, but nothing else. And in the meantime, like, I used my old New Jersey Direct 15 card before I got my card, and I had no issues. I would say that when you get your new card, make sure, give your doctor the new card because you have it. But until you get it, there should be no problem finding you in the Horizon system. So remember, your plan, the plan itself hasn't changed.
And so in terms of what people should expect, so for example, in terms of our colleague who asked about, who had been switched from Aetna to NJ Direct, and now on the October 1st is going to be switched over there. What should that individual expect? Should it just be new cards coming in?
The individual should expect new cards. They should expect a slightly different payroll deduction, probably, assuming they have either Omnia or the PPO plan. And they should expect that if they use out-of-network providers, they should expect a higher out-of-pocket expenses.
Okay.
If they're using all in-network providers, they should really expect no change. I haven't seen any change for myself, because I haven't used any out-of-network providers since I switched to the Unity Direct plan. I experienced no change at all in how things work for me benefits-wise.
And one more, then others can jump in, but one of our colleagues was asking and saying that they seemed to remember that there was a switch or some alteration in terms of the labs, the lab companies that we can use for test and blood work.
So outpatient labs, I can't remember if the switch was January of 20 or January 19. I think it might have been 20. It used to be that for Horizon people, LabCorp was the only in-network provider, and for Aetna people, Quest was the only in-network provider. I think it was January of 2020, so both Quest and LabCorp for outpatient labs are both in-network now. Quest and LabCorp. Any other outpatient lab, I think, to do yourself a favor, you should call Blue Cross before you try anyone other than those two. I know sometimes people that go to University of Pennsylvania doctors, and they have their own lab. I've heard some people talk about Atlantic Care Labs. I would just say, if it's anything else other than Quest or LabCorp, call Horizon first, just to be sure.
I also have somebody who says that they went to a CVS to get their flu shot, but they were told that they're no longer on the insurance.
I think I saw something recently. Yes, the CVS is not doing the flu. They're not on the insurance for flu shots at CVS anymore. Mark that question down, though. I'll confirm that, but I'm pretty sure I saw an email or something on the state site regarding that.
If it does help whoever asked that question, Walgreens does take our insurance. I just got mine done
This
last
year,
week.
so you're good this year? Okay.
I happen
Yeah.
to know that CVS has this glitch in their system. If you go to CVS to get a flu shot, you can call the number on the back of your insurance card and they'll basically speak to the pharmacist and give them a little code to punch in. They said over at Horizon that they're working on this glitch, that technically you should be able to get a flu shot at CVS, is what I was told.
And that's recently?
That was yesterday.
Okay, okay. So Walgreens is now what was Rite Aid, right?
Yep. Yeah. So, and they do it no problem. You can just walk in and get your prevention.
This was asked, Bart, you may not know this, but someone is asking, have they added more acupuncturists to the in-network plan?
I mean, I think doctors, I think all providers get added and drop regularly. I don't think, nothing related to this plan switch, but I would just keep checking the provider directory and that will be updated as things change.
Also,
Oh, wait, and I don't have the exact amounts. The exact amounts are on one of those attachments. Just be careful, out-of-network acupuncture and out-of-network chiropractors. There's like a fixed dollar amount for the visit that's all they'll pay on out-of-network. So if you're using out-of-network providers there, just be careful.
okay, I'm just checking to make sure on our.
I
So,
see.
yeah.
I see a question, I guess, from an adjunct or for an adjunct. The rates for 2021, like if you're paying the full premium, the rates aren't yet released, but in time for open enrollment. So the end of this month or the beginning of October, we should see the 2021 rates for part-time employees.
Someone is asking, they're having a little confusion looking at one of the guidebooks about whether adult eye exams and further eye care for problems other than contacts or glasses are covered.
The annual exam, once-a-year eye exam, is covered through the medical insurance. I mean, the glasses, contacts, not covered. So you have that very, very small reimbursement that is provided in the contracts. We always recommend for glasses, that's where the flexible spending account comes in handy to pay for glasses. Medical problems for like if it's a medical problem with your eye, that also generally goes through the insurance. And you want to use in-network ophthalmologists.
We have one in which an individual is asking about mammograms, not seeing those as listed. Are those now a imaging and hence require pre-approval?
So flag that. Somebody mentioned that there's it's listed on 38. So flag that question and I'll confirm. I mean, to my knowledge, nothing has changed. Like this new change October 1st wouldn't impact that. So everything for those kind of things should be the same as it was before.
Just writing that down.
Okay. I asked that when I talked to Blue Cross, as these things change, I tried to ask the question in many different ways. Is there anything that any surprises people would get other than, the things posted, the copays and deductible? And they basically told me it's the same plan. And Optum told me the same thing, except for the copays.
So Bart, I had somebody text me one personally. Does any of what's taking place affect in any way our dental care?
Dental is not impacted at all.
Okay.
So unless, again, remember, I haven't gotten anything about open enrollment. Unless there's some changes to the dental plan for 2021, none of this affects dental at all.
All right, so if I should have made a number of you privy to a Google Doc, which is listing our unanswered questions, and so you can check to see that if that's in there. I think We've answered a number of the ones that were in there. We still have the R Health and the Urgent Care Center questions out there, which Bart is going to look into more fully.
Okay.
For the audience, for our participants, please look over. We believe we've answered the questions that we put the questions to Bart that you've asked. Those which have not been answered, I believe we've got now gathered on our unanswered questions list that Bart will be able to research. But please look through both the Q&A and the chat to see if your question has not been followed up on, and we'll go back and ask on that.
Some folks were just making sure, just to reemphasize, when we do send out the recording and everything to everyone, we'll include all of the links that were sent out in the chat today if people have difficulty accessing them, just so you can continue to peruse and search through them.
Yeah, and you know, just to reiterate, you know, the two unions that changed before you, you know, we did not have, nobody was coming in with any big problems, like there was some drastic difference after the change. You know, I think for most people, it was pretty seamless. And if there were, you know, any hiccups, you know, they weren't really brought to our attention. So it must have been something that, you know, would have been something that would have been straightened out pretty easily. So I don't think there's any, you know, from my own experience too, you know, nothing scary about this change.
Bart, just so we can cover something as well. So the open enrollment, for people who haven't been in this kind of situation before, right? And it's a little bit odd because we're both doing a switchover and we're beginning an open enrollment period, correct?
Right.
Right. So what this means is that NJ Direct is going away as of October 1st, correct?
NJ Direct 15.
Direct 15.
Yeah, with the number extensions, they're all for the unions. They're all going away.
Right.
So it's just one. They simplified it to one PPO plan.
And that is actually coinciding with the open enrollment period, which again, for members who may not be entirely familiar with that, can you just explain for people what is meant by an open enrollment period?
Yeah, so the open enrollment is the opportunity to change medical plans. It's the opportunity to add qualified dependents if you hadn't already added them. So for instance, if you got married mid-year and didn't add your spouse at the time you got married, and now you want to decide to do it, you could do it at open enrollment. I mean, the big thing, excuse me, is plan change. So for the people in the PPO plan and the New Jersey Direct plan, your option would be to either change to an HMO, to the tiered plan, or to the high deductible plan. For the people in the HMO plan, you might want to look at either going to the tiered plan or the PPO plan. I mean, you know, HMO plans are fine in my opinion. I mean, for me, you know, I don't like, for me, it's a no-brainer. I would never take an HMO over a PPO because PPOs give you that out-of-network flexibility that you do not have with an HMO. I mean, yeah, the deductible's higher, but you still have the ability, you still have some coverage out of network, which you don't have with an HMO.
And that's even with this new one that's been put in place.
Yes, absolutely. So yeah, I mean, the PPO plan, the New Jersey Direct plan, prior to October 1st was the most comprehensive benefits plan you had. After October 1st, it's still the most comprehensive benefits plan you had. The PPO is. You know, you would save, if you run the numbers for the Omnia plan, you would save money on the Omnia plan payroll deduction wise. If all of your providers are in tier 1, you would save money on the out-of-pocket costs. But just remember, in tier 2, you are paying higher out-of-pocket costs. So you really want to, and one of the links, I believe, one of the links I sent was and it's going to certainly be in the email I sent you, is the provider directory. So the Horizon provider directory, I would, here's me begging again. If you're considering going to the Omnia tiered plan, really take the time to search every one of your providers to see what tier they're in. Make sure they're in tier, if they're all in tier 1, then, you might say you'd save money per pay and you'd save some out-of-pocket costs. So it might be the right plan for you. Remember, you won't find any tier 1 providers outside of New Jersey. So I always tell people, like when we do orientation, and Johanna always makes fun of me about this because she says I sound morbid. Not only do you want to check the doctors that you currently go to, but ask yourself the question, if I ever got really, really sick, where would I want to go? Look up those doctors and hospitals, see what tier they're in, because that's going to determine, ultimately what your out-of-pocket expenses are going to be.
Bart, we have a question, and the individual says, she could understand if you don't necessarily know the answer, but are there any significant changes to the provision of DME by in-network providers?
Nothing that has been advertised or no communication from the state on that.
And nothing that you've experienced thus far with either CWA or IPTI?
No.
Okay.
No.
And again, we do have that advantage.
So that's a question. That's a question as those situations come up, or you're starting to have these conversations with your doctor. That's a question I would totally recommend just getting on the phone and calling Blue Cross and asking those questions.
Yeah, and on that topic, somebody had asked if there's a better direct customer service line than the number on the back of their card, or is that really where they just?
No, that's the customer service line. So it's a little easier now to actually talk to a person because they've kind of changed they have health. They're called health guides now. I think with a health guide, if somebody's helping you with a problem, you can now connect with the same person every time you call, where that wasn't the case before. Like whoever the rep you talked to before would leave notes, but the odds of getting the same rep were not very good. I think with the health guide now, you can talk to that person. They may even give you their number if there's follow-up.
Folks, one more time.
I saw a question. There's a question came in. Yeah, PPOs do not require referrals for specialists, and that is the same. That's case going forward, October 1st.
So, folks, sort of a last opportunity to ask any questions of Bart. And as I said, we had about 4 or 5 questions which weren't answered live, but we've gathered those up and we'll send those along to Bart that he can research and get back and put out the information on it. We'll put it out there. We're going to post this recording both on our SFT Union website YouTube channel, as well as I believe on the SFT website, but we'll put that up. We have another, okay.
And I would say after the emails for open enrollment come out, like once we have information on open enrollment and we send those emails out, if you want to come and talk open enrollment, what's the best plan for you, definitely come and see either me or Johanna, and we'll go through that with you.
Is there anything else that any of the panelists want us to cover or think we should cover before we break? And no, Bart, is there anything you want to say in?
I think I covered everything that take those little hints.
Right.
Little strategies, because it's really terrible to have to deal with the bill after a bill and back and forth with the insurance. So really, as much as possible, try to be proactive. And obviously we are here, if you have claims issues, try to resolve them yourself. But if you're getting nowhere, obviously we would need you with us to call. But if you think there's a way that, you're not understanding what they're saying or whatever, and you think it would help if we called with you, feel free. That's why we're here.
All right, folks. I want to thank everyone for attending and all your questions. And as we move forward on this, it's always important that you keep in contact with us in the union leadership as well, so that we can have, when we go to the next time we're negotiating for something like this, your information, your background, what's something we should prioritize and the like. That's essential when we go to the state on these issues. Because remember, as Bart pointed out at the beginning of this, one of the essential features that drove all of this was the fact that we had lost our ability to negotiate our healthcare plans in large extent due to legislation that had taken place several years ago, and the other unions were adamant about getting out from underneath that restriction. We were able to do so, and that's a major victory in the last round of union negotiations we did. And what it does do is it allows us to have more autonomy and ability to fight for you when we go forward. All right, everyone, thank you very much.
Thanks, everybody.
I'm not sure who actually can shut. Stacy, can you shut it down? And could the officers please reconvene?